My question for you is regarding the ratio of the clinical trial versus the population. Don't you think it's better to do a ratio per center or number of universities in each country, which may give you more or better ratio, in my opinion, at least?
Thank you, Dr. Humaid. Very nice notice. So actually, there is literature of how you adjust. And one of the things that people suggest is using what you suggested now, is because the number of clinical trials, the number of research generally would correlate with the number of academic staff you have, with the number of hospitals, with the number of research centers. So that is probably a more accurate normalization of this and a proper comparison between countries. However, for the project that the student did, it was difficult to get this information out of the GCC. The easiest is to look at the population and maybe the income. So even if you looked at the income, the pattern is the same. These are the two things that we looked at. And unfortunately, we could not get the data to look at what you suggest in terms of the academic center and academic staff.
Another idea, actually, which we are working on right now, very similar project, but at the level of MENA, is number of citations. I think that will be very interesting. Lots of work involved looking at the number of citations coming from each country. This is something, maybe an idea for you guys to consider as well.
Actually, can I address this as well?
Yes, please go ahead.
The pattern. So I looked at that pattern maybe a few years ago in specifically lymphoma research. I mostly do like transplant acute leukemias, but at that time it was mostly a research about lymphoma. So the observations we did, they call it citation networks, where you see something like Emirates airline with like multiple connections. And then this is what a citation network is. So the observations are, one, we don't get a lot of citations as specifically GCC region. So that's one. The second thing, the documents that we cite is not from our area. And unfortunately, even if some of us do write, we get a good publication output in cancer and other fields from the region. However, we don't cite each other. We look at like major articles. I know that is understandable, but then if you do a study from your region, it is probably almost a mandate that you look at your own circumstances from your country, from your region, and cite that work. And unfortunately, that is not done in lymphoma, and probably I expect in other forms of solid tumor.
Yes, I agree with you, Dr. regarding citation. And a question for, Dr. Marcia. The question is, what's the plan to support cancer care research during the COVID time, as most of the submissions are returned even before reviewed due to the focus on COVID research? Maybe this was initially the COVID, but certainly I would like to hear your opinion about that.
I don't think, at least for the Lancet Oncology, that we are returning any submissions just because we are receiving other COVID submissions. I think as an oncology journal, our main aim will always be publishing the latest research on cancer. So I think that would not be the case. I think for some broader scope journals, that would be indeed a factor. But I think if we look at the market, and oncology is for sure the dominant research worldwide, not specifically for this year, but worldwide, I think there will always be a space. And I think as long as the trial is a good one and is practice changing, there will always be space for cancer research to be published in high impact factor journals.
But certainly the initial phase, there were lots of COVID papers, and the major journals were looking more about the COVID. But now we are seeing more and more shift for non-COVID paper, and at least this is from my experience and from being in touch with Lancet Oncology and JAMA Oncology over the last few months.
Yes, of course. I think in the beginning, there was obviously a rush to try to understand COVID as much as possible. And not only just COVID as an isolated disease, but with other comorbidities, and particularly for patients with cancer, we had to understand the impact the disease would have, and even in our healthcare systems, because I can only tell from the experience in the UK, but I'm sure other countries suffer the same problem, where a lot of patients with cancer, and we've heard here today, that were not screened or treated on time. So that was our main focus initially. But obviously, as the, let's say, acute phase is sort of gone, at least in the beginning where we didn't know anything about the disease, obviously cancer research will be again one of the main players for journals, medical journals.
But
Dr. Humaid, there are some questions. Yes. There are some questions in Q and answer. If we take from audience, please carry on.
Actually, Professor Mark, he has a comment regarding the citations.
Yeah, no, just to say, we did a study on Central and Eastern Europe and the CIS and the Federation, and we looked at journal impact factor citations, a number of different things. I've just put the paper was published in European Journal of Cancer in the chat. It just might be useful for people, because we were able to also look at using it to help influence policy in terms of both the type of research that was done, in terms of research focus, also in terms of policy in relation to the diseases that were studied. And so just that might be useful to people if a number of different groups in the different countries in the Gulf are doing that type of research. I'm very happy to help in relation to methodology or if it's helpful to people.
Still, we have 3 minutes, 40 seconds. Dr. Humaid, if you read Mustafa Sharifi and Professor Samar questions on the Q&A, or shall I read it?
Go ahead, because they are only comments. Dr. Murtadha, he has a question regarding how many clinical trials in oncology in Kuwait.
Yeah, Mustafa, Murtadha, one question for you.
Sorry, I was mute, Yani.
How many clinical trials in oncology in Kuwait? You are not Kuwaiti, but you covered the GCC.
Yeah, but unfortunately, I did not specifically look into the oncology. Specifically, I looked at the clinical trials. However, if you look overall, if we assume that the distribution of whatever I presented globally would be applicable to also Kuwait, it would be probably in the 20 years, less than 20 clinical trials. So that is more of assumption. I did not directly look at, I just looked at the, now seeing the question, the number of clinical trials from Kuwait in the 20 years, and then the proportion of oncology out of all the clinical trials reported.
Thank you. 2 minutes, 2 questions, both I believe are directed to Dr. Marcia. From Summer, Professor Summer, what is the plan to support cancer care research during COVID time, as most of submissions are returned even before review due to focus on COVID-19 research?
So I think, as we were discussing before, for the Lancet Oncology as an oncology journal, our priority is obviously only cancer. I think for other medical journals, although in an initial phase there was obviously a huge interest in COVID-19, I think it is shifting. And I think since oncology is such an important research market and it is such a big burden worldwide, I am sure all the journals will be working very hard to, in a certain way, keep up with the pace. Because if there was a delay, and I think Mark mentioned this in terms of treatment and diagnosis, we will now have to sort of make an effort to publish as many or more papers on oncology to make sure all the novel research that was not published so far can be published within the next, I don't know, 6 months, 1 year. But I'm sure all the journals will be moving toward that. As soon as, the vaccines, get in the market, obviously there will still be COVID-19 research, but it will not be maybe such a primary focus as it was in 2020.
Thank you. I have 1 minute to wrap up. Thank you, our distinguished speakers. Thank you, Prof. Mark, Dr. Marcia, Dr. Abdelal, Dr. Murtadha, and thank you to Dr. Humaid for saving me in the very last minute. Thank you for the organizing committee. Mark was right, data cancer is very important. I know, is it emerging with global cancer, data cancer, delayed, and everybody agree that there is delay in diagnosis and sadly referring patients, and this of course delay in research. there is disruption either mentioned by Professor Mark and Dr. Murtadha. There are some nice view from oncology. Sorry, that's my timer telling me I have to stop, but just I finished this one, which I love to hear it from Marcia. Lancet advocates changes and how you do it to reduce the disparity in healthcare. What are your actions? If the answer is too long, just one line.
I think
we have disparity. Disparity of cancer is very painful. If you see disparity between East and West, I am preparing a paper in this regard, which I just last year I presented in one of the conference, and I want to write it. Disparity is a painful. What Lancet is doing, you said you advocate, you do more than journal. That's when you are doing something where you are in minimizing disparity. 30 seconds.
Okay, I would say the biggest, our biggest projects are either through commissions or through editorials. And the way we try to create change, it's because we held those that are in power accountable. So we go to, sometimes we write about government, sometimes we write about agencies. And we specifically ask our authors to give very precise key points on how these governments and agencies can act in their countries to improve their healthcare systems. And that's the best way we can support, is to provide the evidence and then go and poke those that are in power and then should be doing something when they are not.
Thank you so much. Thank you, everybody. And God bless you. Hope to see you soon after COVID in real life or in any new virtual meeting. Thank you. And I hope we can publish few papers in the Lancet Oncology in this regard, in the meeting, the summary of the meeting.
Thank you very much. Thank you. It was a pleasure.